Safety and care of hostel residents. It is important to keep certain points in mind while staying in campus. Avoid on-campus gatherings. Do not form a group in carrying out any kind of activity inside the hostel. Avoid getting into the group while eating or having lunch or dinner in your hostel. Do not get together during your leisure time in hostel. Maintain the social distance of at least 1 meter with a person even inside the campus. Avoid group reading in the hostel room. Cleanliness and safety of hostel rooms. Ensure a clean and hygienic hostel environment. It would be good if each student have their own separate room and washroom in hostel. Sharing of room should be only amongst 2 students and not more. Ventilate your room every day by keeping window and door of your room open for some time. Keep your room clean by using disinfectant. Clean frequently used things such as doorknobs, floor, study table, chair, and windows using disinfectants. Change your bed covers and pillow covers every alternate days. Supervisors should undertake regular monitoring to ensure that existing hygienic standards are strictly observed. Important points about personal hygiene. Perform hand hygiene frequently with soap and water or with 70% of alcohol-based hand rub. Do not spit around the hostel campus. Cover your nose and mouth with the tissue paper when sneezing or coughing and have the tissue paper discarded into the leaded garbage bins afterwards. Individuals with signs and symptoms of respiratory infections such as coughing, sneezing, headache, etc., respiratory hygiene or cough etiquette should be observed. If you feel unwell, you should seek medical advice promptly to prevent the spread of infection in the hostel. Change and wash uniform frequently or whenever it is grossly contaminated. Cover your wound or cut with a waterproof dressing. Sharing is not caring in pandemics. Do not share your personal belongings such as earphones, cell phone, laptop, bags, wallets, cosmetics, towels, clothes, and other personal items with your friends or roommate. Instances when to perform hand hygiene. Hand hygiene should be performed before touching your mouth, nose, and eyes, before handling, preparing, or serving food, after using tissue paper to cover your mouth and nose while sneezing or coughing, after using the toilet, or after touching public installations or equipments such as escalators, handrails, elevators, control panels, or doorknobs. Respiratory hygiene. Cover your mouth and nose while coughing or sneezing. Use tissue paper to contain respiratory secretions and dispose them promptly in leaded garbage bins. Perform hand hygiene after hands have been in contact with respiratory secretions. Offer surgical mask to persons with respiratory symptoms when tolerated, especially during epidemic. Encourage persons with respiratory symptoms to sit away from others, ideally for more than 1 meter. Provision of resources. Hostel management staff should ensure that the materials for adhering to respiratory hygiene or cough etiquettes are available in hostel. Provide lidded garbage bins for use of tissue papers disposal. Provide surgical mask when in need. Let's see the video on how to wear a mask correctly. Cleaning of common areas and common toilets and washrooms. Hostel lobby. Regularly wash and wipe building entrances, doorknobs, handles with detergent and water or in 1 in 99 diluted household bleach solution if necessary. Clean public toilets with 1 in 9 diluted household bleach solution frequently. Every public washroom should be equipped with liquid soap, paper towels, and hand dryer. Clean toilets of the guest room at least once a day. Wipe the rim, seat, and lid of the toilet bowl with 1 in 99 diluted household bleach solution. Rinse with water and then wipe it dry. Make sure that the drain pipes are built with U-shaped water traps. Do not alter the pipeline without authorization. Clean floor drain outlets at least once a week to prevent putrid air and insect in the soil pipes from entering the premises. Pour about half a liter of water into each drain outlet regularly so as to maintain water column in the pipe as waterlock. Here are some of the dietary guidelines that need to be followed during epidemics. Eat a well-balanced meals during any epidemic. Avoid eating junk or processed food. Include fruits and vegetables in at least 2 meals a day. Include a handful of nuts such as walnuts, almonds, raisins, etc. in at least 1 meal of a day. Include at least 1 spoon of oil seeds such as sesame and mustard seeds with your meals. Avoid sugary beverages and foods. Foods to be included to boost your immune system. Fruits such as pomegranate, which has the anti-inflammatory and antioxidant property, helps to enhance the immune parameters against viral flu infections. Other fruits such as papaya, guava, amla have antioxidant property and are also rich in beta-carotene. Foods such as garlic and ginger have immunomodulatory properties which enhances immunity. Spices such as turmeric have anti-inflammatory, antioxidant, anti-carcinogenic, antithrombotic and cardiovascular protective effects. It is also immunostimulant which prevents injury to lung tissues. Other foods such as dry fruits like walnut, brown raisins and almond contains essential amino acids which boost immunity by producing immunoglobulins. Foods like green leafy vegetables contains flavonoid which acts as an antioxidant. It is also important to support mental health during epidemic lockdown. Kindly note the following points which are important to maintain and stabilize your mental health during lockdown. Minimize watching, reading or listening to news about COVID-19 that causes you feel anxious or distressed. Believe only on trusted sources for information. Stay away from rumors. Activate your social contacts to provide you with assistance if needed. Keep regular routines and schedules as much as possible or help create new ones in new environment, including regular exercising, cleaning, daily chores, singing, painting or other activities. Keep in regular contact with loved ones via telephone, email, social media or video conferencing. During times of stress, pay attention to your own needs and feelings. Engage in healthy activities that you enjoy and find relaxing. Eat healthy food and avoid junk food. Let's do Namaste and avoid shaking hands with each other. Namaste.